Hey guys, Posture Me Perfect is back with our latest video all about high altitude. Okay, so I'll be honest with you guys. Of all the things that I'm worried about with regards to this Kilimanjaro climb, high altitude is probably the thing I'm most terrified about. So I know this is one thing your body has absolutely no control of. I can get as physically fit as possible to prepare, but with terms of altitude, I'm not sure what I can do to prepare. So I thought it might be good to ease my anxiety a little bit by chatting with a friend of mine who's also an emergency physician who may see this condition a little bit, not too much, but would definitely know what to do with regards to the treatment of it, the prevention of it, and how to spot it. So we chatted with him all about high altitude and he gave us the lowdown.
Altitude sickness is probably the bane of existence for a lot of these major big-time hikers, people who do this on a regular basis, trying to get to the top of Kilimanjaro, almost 6,000 meters, trying to get to the top of Everest, 8,800 meters. People are trying to get to these levels, and despite all their training, despite all the exercises and the things they do to get themselves ready to get there, they sometimes can't make it, and it's as a result of something like altitude sickness. So it's something to be aware about, and we're going to talk about it. People think it's about oxygen levels, not having enough oxygen, and that's sort of true. We actually do have 21% oxygen, and we're able to get that at sea level, but you're also able to get that at 8,000 meters up above sea level. The issue really has to do with pressure. Now, at sea level, we've got a lot of pressure, and if you can imagine sort of a box with a bunch of different molecules, so nitrogen, oxygen, hydrogen, and they're all sort of squeezed in together. And when you take a big gulp of air down at sea level, you're going to get that oxygen. They're all so closely bound together so that when it goes into your bloodstream, you're able to sort of absorb it a lot quicker. But as you go higher and higher up, the pressure actually goes down. And as a result, these molecules that were nice and close to each other are now much further away. And so there's these gaps, if you will. And as you take that big gulp of air in, you've got gaps, and so you're not getting as much oxygen, so to speak. And that's sort of the issue behind why people have all sorts of symptoms. Symptoms of altitude sickness are kind of difficult to define. The vast majority of people feel like flu-like illness, if you will. So nausea, fatigue, headaches. These are sort of the classic symptoms that people describe, and these are sometimes also the more milder forms. As things start to become more severe, they can start to develop complications, specifically in their brain and in their lungs. And in their lungs, what you tend to get is this leaking of fluid around the capillaries, and people get short of breath. They can have this frothy cough, and they can get quite, they can be quite short of breath to the point where it can be quite dangerous. The second one that we worry about is where people can start to get leaky vessels in the brain. And as a result of that, they start to get confused. They can start to have more vomiting. So these are two worrisome complications, and they even have their own special names. They call them high-altitude pulmonary edema for the lungs and high-altitude cerebral edema for the brain. For these ones, of course, is a much more severe, concerning story, and for those ones, we definitely have to enact immediate treatment, and we're going to talk about that a little bit more. So the big thing, obviously, the golden rule of doing one of these climbs is to go slow and let your body acclimate. Everyone's a little bit different. Sometimes you hear the story about young, fit, healthy guys who really can play, sports and play at a high level, and yet they go on one of these climbs and they're the ones who get sick. And you see the older person who really isn't that physically fit who's doing it better. And it all has to do with the fact that people just try to go too hard sometimes. And the whole idea with this is you gotta go slow and you gotta let your body acclimate and let your body do what it's supposed to do, because it will usually improve. It just needs time. But the big things we all know is trying to prevent some bad things from happening. The number one thing that we try to prevent is dehydration. So it's really important when you go on these climbs that you got to be drinking fluids. It's very important that you're going to be taking in lots of fluid to the point where you're peeing on a regular basis, even more so than you would, say, at sea level. And when you're peeing, I know it sounds gross, but it's almost clear, basically. That's how we know that you're keeping yourself nice and hydrated. The next thing is you want to try to prevent things that can put you into trouble. One of the big things is alcohol. Alcohol is a well-known diuretic. It's well known to help you pee and that you pee a lot, and that can be a dangerous thing when you're trying to prevent dehydration. Also, alcohol has the ability, as you probably well know, to muck up the sensorium a little bit too, and that can be a dangerous thing when you're looking out for confusion. Remember, we talked about those things with cerebral edema where people can start to get confused and have vomiting. So we always try to encourage people not to take alcohol when they're doing these climbs. The next thing is medications that you may normally take for other conditions we try to avoid when you're going on a climb. For example, sleeping medicines that people commonly use, things like Ativan or benzodiazepines. We try to prevent those because they can sometimes affect your ability to do for breathing, especially when you get more erratic breathing. Other things are painkillers that have narcotic base to them, so Tylenol 3, Percocet, Vicodin, Dilaudid, things like this, where they can also affect your ability to breathe and decrease your respiratory rate. Other painkillers, things like Tylenol and Advil, are safe and in fact are recommended first-line treatment for headaches that people get when they're on these climbs. So what do you do when you start to develop these symptoms? So if you have mild symptoms like we talked about, developing a bit of a headache, developing, not feeling a bit nauseous, things like that, you can still use things like Tylenol and Advil, and to give that a trial while still acclimating. And sometimes what that means is just staying an extra day or an extra 2 days where you are to let your body just get used to it. And if you are able to do okay, this is assuming obviously your symptoms are mild, then you can continue on with your climb. But if at any point you are starting to feel worse, things are not improving, or you're starting to develop more severe symptoms, the absolute rule for this is you need to descend. 100%, the only way to bring things back to normal is to bring you down. And you just have to come down, and usually your symptoms will resolve with that. So you try not to rush this. You have to have a bit of a humility in your climb, despite all your training. Understand what your body's telling you and listen to your body. And when you're starting to feel unwell, you need to descend. That's the only way to treat the problems that you can get and the complications that can come from this. So go slow, acclimate, and if you have problems, descend.
Thanks to Dr. Chris Samuel for really preparing us for this Kilimanjaro climb with respect to high altitude. Don't forget to subscribe and don't forget to like this video. We have a few more coming out.